Good afternoon, everyone. My name is Cassie Hopkins, and I'm with Houseman Group, and I help coordinate the webinars over here. We'd like to welcome you today to the reality of fertility impact on employee well-being and your bottom line. We have a lot to discuss today, so I am just going to give a very quick overview of some things you can expect during the webinar, and then I'm going to kick it off to Elise and Laura, our wonderful employee benefits consultants who are moderating this webinar today. So a few things to note is that this webinar is recorded and you will get a copy of the presentation slides emailed to you. So even if you can't attend for the whole webinar, you are going to be able to access it at any time along with a copy of the slides. We won't have any slides up during the presentation, but we will be showing our HRCI and SHRM CE credits at the end of the webinar. This is also an opportunity for you to get familiar with the Q&A on our Zoom. If you look at the bottom side of where you are in Zoom, there should be a Q&A feature. If you think of any questions during the presentation, we are going to save all of them for the end, but you are welcome to enter them at any point when you think of a question during the speaker's presentation. With that, I'm going to turn it over to Elise and Laura, and they will welcome our wonderful panelists for today.
Thank you, Cassie. As you mentioned, Elise and I are employee benefits consultants here at Houseman Group, and we'll be moderating the webinar today. We are so very passionate about this topic and developed the webinar because we do understand infertility is a very important topic that a lot of additional awareness and support needs to be generated around yet. In my opinion, it's everything we don't want for our employees. It's mentally, physically, emotionally, and financially exhausting, and it impacts all aspects of life for those on a fertility journey. In fact, we've come to understand and heard that infertility diagnosis can be as stressful as a cancer diagnosis. So with that said, before we get into the details, we want to take a moment to allow our fabulous panelists, Dr. Elizabeth Pritz, Shane McPeak, Kathy Willagora, to introduce themselves and share a little bit about why they chose to participate in today's webinar. Dr. Pritz, if you wouldn't mind.
Hi, everyone. Thanks for allowing me to be here today. I'm pretty excited. So I'm Dr. Elizabeth Pritz. I'm the medical director of the Wisconsin Fertility Institute and also the INVO Center for Infertility in Tampa, Florida. I did an OBGYN residence and then a fellowship in infertility, another fellowship in advanced gynecologic surgery. And so I take care of all aspects of women that are undergoing fertility care. And I've been doing this for about 25 years.
Thank you. Shane?
Yeah, I can go next. Hello, everyone. My name is Shane McPeak. I'm the Director of Human Resources that supports compensation, benefits, and newly acclaimed HR systems at Trek Bicycle Corporation over in Waterloo, Wisconsin. We have a pretty awesome and amazing story to tell related to fertility and family-friendly benefits. So when I was asked to join the panel, I was a no-doubter, knowing the team that I'm going to be up here with. And again, just looking forward to sharing some insights of our journey in navigating the fertility maze throughout the course of the last few years.
Thank you, Shane. And last but not least, Kathy.
Thanks, Laura. Hi, everyone. My name is Kathy Willagora. I am here today first as a mom after recurrent miscarriage and infertility. My daughter was conceived via IVF, and she will be 1 year old on May 12th. So I'm here to talk about that experience and how infertility sort of impacted my daily life, how it affected my mental health, and I think importantly, how having insurance coverage because of Illinois state law allowed me to build my family. I also, have worked at EverThrive Illinois, which is a small Chicago-based nonprofit, for the last 12 years. I'm happy to share a bit more about how my employer supported me through my journey with infertility, and again, talk about what a difference it made. I live in Pleasant Prairie, but what a difference it made to have that Illinois-based coverage, which was required to cover fertility treatment.
Awesome. Thanks so much to the three of you for joining us and volunteering your time really to be here today. We're grateful and lucky to have such great experts on the call with us today. there are many profound data points that Laura and I have found in doing research on fertility and fertility benefits. And one that really stands out is that infertility is a serious diagnosis that can impact 1 in 8 heterosexual couples, which is about 6.7 million people in the US. And just a disclaimer there, this is for those that are diagnosed and treated for infertility that are accurately tracked in our systems. And in fact, that is more common than a cancer diagnosis or even those experience depression, which are really commonly talked about today. So we know that this can affect any individual, whether it be female, male, heterosexual couples, even same-sex couples. So Dr. Pritz, I wonder, can you provide some context about what infertility is and how different individuals may experience it?
Yeah, so I'm going to start with the basic heteronormative definition. And if you're younger than 35 years of age and you have been unable to become pregnant after 12 months of unprotected intercourse, that is infertility. If you're greater than 35 years of age, and we're talking female partner age here, I'll tell you why in a second. Then after 6 months of unprotected intercourse, if you have been unable to conceive, then you have infertility. However, if you branch out to cover all people, if you're in a same gender relationship, 2 women, 2 men, obviously you have infertility from the get-go. So you shouldn't wait for a year. Come on in, let's get looking at what's going on for you. If you are a man and you know that you have no sperm, if you're a woman and you're not ovulating, not dropping 1 egg each month, obviously you don't wait for a year, you come in and start talking to a professional, working with your OBGYN, working with your infertility doc. And the reason that I focused on those ages for women is that by the time women are 35, our fertility starts to wane. At 40 years of age, only 30% of us can create pregnancies with our own eggs. And at 43, only 10% of us can create pregnancies. So really the onus is on, for the most part, the female partner.
Mm-hmm. Yeah, thanks for sharing those statistics and just giving a little bit of a definition around it. We know that oftentimes surrogacy is part of the conversation too. How often do you see that coming into play in your practice with your patients?
Yeah. We used to work with surrogates a lot more often. I don't anymore because the legal issues surrounding surrogacy have been tricky. A surrogate is a woman that uses her own egg and her own uterus with another male person's sperm to create a pregnancy. What we do now is we ensure that the egg source and the uterus source are different. So I do work with, we call them gestational carriers, just so the definition is correct. And I probably see 20 couples that work with a gestational carrier every year. And I'm a small practice. I'm a very small practice.
And in the scope of that, just curious, 20 out of roughly, to give people a sense of how the volume.
Thank you. So I have about 500 cycles that come through every year. So it's about 20 out of 500. I suspect there would be more people that I could work with if this were covered by insurance, but working with a gestational carrier is the single most expensive product that we offer. And the cost really isn't so much. Yes, the cost of the high-tech treatment here with me is expensive, not relatively, but it is expensive, but really it's the cost of working with the gestational carrier and the insurance companies. That can be upwards of $50,000.
And can you share a little bit more about why that is? I've personally heard of people using gestational carriers and some of the expenses that come in addition to what people would traditionally incur, but can you speak to maybe a couple of those considerations for people not as familiar?
Yeah, so first of all, the embryos have to be created from a different source, and they have to be created through IVF, and the cost of IVF is anywhere from $10,000 to $20,000, depending on which group you're working with. I know that sounds like a lot of money, and if you're talking about high-tech procedures, it's really not. We're probably the least expensive if you're talking high-tech. However, many of the high-tech procedures are covered by insurance, and IVF isn't. So it's about $10,000 to $15,000 to create the embryos. You need legal representation for both the gestational carrier and for the intended parents. That's another $2,000 to $5,000. You'll need infectious disease screening for both the intended parents and the gestational carrier. And this testing has to be completed at an FDA-approved laboratory. So that's another $4,000. We do genetic testing and genetic counseling. That's another $5,000. We do a psychological evaluation, and not so much an evaluation, but just to ensure that the gestational carrier understands what this means and what she's getting into. Because emotionally, this is a big deal to carry a child and then pass the child off to the intended parents. So when we start adding those costs on top of the $50,000, the cost gets even higher. The $40,000 to $50,000, that's usually what the gestational carriers are paid, because this can be a life-threatening endeavor. They could lose their uterus, they could lose their ability to have children of their own in the future. And I did have one gestational carrier that I worked with that she could never have children of grown in her own body. So yeah, it's a lot.
Well, thank you for that. We understand there's so many different reasons that people might seek your support in building their family and different ways of going about it. We've also heard that there's ties and larger considerations around some specific populations that maybe people don't hear or think about as often, like those who have gone through cancer treatments, active military veterans who have been deployed. Could you shed a little insight around those types of circumstances or any other populations that maybe people don't often think about?
Yeah. So for cancer patients, it depends if it's female or male, but particularly for male patients, if they become sick with a cancer, oftentimes their brain, their hypothalamus, which sends down all the hormones to get the eggs or to get the sperm to mature, those hormones are out of whack. And all of the resources of their bodies go in to fight the cancer. And so sperm is not produced correctly or adequately. The sperm just kind of sits in the testicles. And so for those men, already if they're ill, they may not be creating sperm. The treatment that they undergo, if it's chemotherapy or radiation, can also obliterate even the immature sperm that live in their testes. And so they could lose their ability to create a pregnancy. Oftentimes these men are freezing their sperm as soon as we can get them in to see us. For women, it's similar. However, when women are ill, for some reason, our eggs remain protected. So it's a little different for us, but there are a lot of treatments, chemotherapy and radiation. And these treatments are going to lead to obliteration of all the small immature eggs that they have living in their ovaries. And women, we're born with all the eggs we're going to have, and which is 1 million. And so oftentimes this chemo or radiation will obliterate all of those immature eggs, and then they've lost their ability to create a pregnancy using their own eggs. They oftentimes will freeze just their eggs or create embryos with their partner and freeze those down as well. But again, none of this is covered by insurance. For the active military, that's really a big one. There are some injuries that happen for men and women that are in the active military that can affect their ability to conceive. And currently, there is coverage in Wisconsin, which is pretty rare, for IVF, for sperm extraction, for many of the more high-tech treatments. If a patient is a veteran or active military, but their day-to-day work has not caused the infertility, some of the lesser treatments are also available to them, including growing an extra egg each month to increase chances of success, or doing the intrauterine insemination, the turkey baster. And that is being supported whether or not you had problems during your active care as a military person.
Yeah, that's super impactful. Some of those statistics I hadn't heard yet even. So, I mean, it's just something to consider, those populations too, just in the discussion.
Yeah, and there's a big issue that everyone's talking about right now, and it's the burn pit toxicity, burn pit exposure. And that, probably is going to be added to the list of active military caused disorders, so that those will start being covered as well. And that's when they're burning, toxic substances or human waste, et cetera, and they're next to those toxic fumes, and that can affect fertility as well. But that's kind of a new one that we just started hearing about.
Oh, wow. It's very interesting. So as Laura kind of mentioned at the beginning, we know and understand that there's a lot at play when it comes to fertility in this conversation. It's physically, emotionally, and mentally exhausting, and the financial strain on employees can be really real. We'd love to kind of open this up to all three of you to share how you have seen or experienced the mental health impact of infertility or someone's infertility journey, and maybe share some possible solutions employers can provide in the workplace to support these individuals going through this.
Yeah, I'd love to talk a little bit about my experience and my journey. My experience of trying to become a pregnant spans from July of 2018, when I went off my birth control thinking this was scary and exciting, but everything would be fine, to May 2020 when I had my egg retrieval. It was early 2020 when I realized I was going to need technology to become pregnant. And then May of last year when my daughter was born. So all said, we were trying to become pregnant for just over 4 years. In that time, I had 3 miscarriages. So my first miscarriage was of my one and only spontaneous pregnancy. At 8 weeks, my second miscarriage was of my first IVF pregnancy at 12 weeks. And my third miscarriage was also an IVF pregnancy, and that was what's called a chemical pregnancy, a very early miscarriage. My journey also, we got pregnant spontaneously, had a miscarriage, thought everything would work out fine. We had no reason to believe otherwise. We were told, come back if nothing's happened in 12 months. And in that time, lots of things started to happen over those 12 months. I didn't know at the time that I have polycystic ovarian syndrome, which is a leading cause of infertility in women, and I wasn't ovulating regularly. So I did my first fertility treatment after a year with my OB, which was just a pill, an ovulation drug. I was told 75% of people will be pregnant after 3 months of using that drug, and I was not. And then I saw a fertility doctor, and my fertility doctor explained to me that for my case, the odds of any other treatment working other than IVF were less than 5%. But that IVF offered a 75% chance of live birth. And like I mentioned, I work for a Chicago-based nonprofit for 10 years. I had been paying into this insurance, and I was vaguely aware it covered fertility treatment because of state law. But in that moment, the coverage for fertility treatment became vital. And my doctor said to me, I will support whatever you want to do. There are a lot of emotional reasons that folks don't do IVF, but you won't have the same financial barrier other people would have because you have insurance coverage. And that was the kind of thing I needed to hear. So we moved forward with IVF. Getting eggs and embryos is easy for me. We created 9 embryos from my one retrieval. But I think for people who haven't done infertility, you hear about IVF and you know all about, without knowing the words, the stimulation process and the egg retrieval process. You know that piece. That's what you see a lot in movies. That part for me was like 3 weeks long. I only did one retrieval. It goes really fast. There's a whole other part of IVF, which is actually getting those embryos back into your body and getting pregnant. And that part for me took 18 months. I needed a lot of cycles, a lot of embryo transfers, because my uterus, as it turns out, we learned from IVF, was not the most receptive environment. So I had 3 embryo transfers that I prepared for using very expensive medications that were then canceled. In my first transfer, became pregnant, but we hadn't genetically tested that embryo because that's not covered by insurance and it costs about $5,000. And then I had a miscarriage because my child had a chromosomal abnormality that was not compatible with life. And so then we tested our embryos and then we went forward, and you need some tries. You need some tries sometimes with IVF. So I did several more cycles. My daughter was my 4th actual transfer, my 7th transfer attempt. And that's why it took 18 months. For me, that cost $40,000 in co-payments, in non-covered services like freezing the embryos and genetic testing, and in acupuncture, which my insurance didn't cover, but my doctor strongly recommended for my uterus issues. So I know that we would have been able to, if we hadn't had insurance coverage, pay for a retrieval and a couple of transfers, some medication, but $40,000 was all we had, and that would not have been enough to treat my infertility. So my daughter is here because of Illinois' requirement to provide coverage and the fact that I had that. When it comes to the mental side, as you can imagine, all of that is immensely challenging to go through. People like to say to me, "Oh, you're so strong, you're so resilient." And I know it comes from a kind place, but the thing about all of us is when we are faced with challenges, we have no choice but to wake up every day and put one foot in front of the other. And my husband and I every day did the calculation of, is this process worth it? Is this process seeming like it could get us to a place where we're going to feel joy? And is this process worth the emotional, social, financial challenges that it presents? That said, it is immensely challenging to suffer multiple miscarriages, to be infertile. And in that time, I was diagnosed with anxiety. I probably had that for a long time before, but I was diagnosed with anxiety. I was also diagnosed with PTSD, and that is directly related to the experience of multiple miscarriages and infertility. IVF is a full-time job. Less than 5% of infertile people will actually do IVF. There's many other treatments. That's something I've learned recently. But when you get to IVF, it is a full-time job on top of the full-time job you can't lose if it's your insurance coverage. So I was in for monitoring appointments where you get an ultrasound and a blood draw, an internal ultrasound and a blood draw every day when I was in cycle because of how I approached it. So that was 6 a.m. every morning at the clinic. When I lived in Pleasant Prairie for the last part of that, I drove to Chicago every morning. So 4:30 in the morning, up, out, get my ultrasound, come home and get to work. I would wait for phone calls between 2 and 4 o'clock every day, letting me know what they saw in those appointments. I had to spend so much time on the phone with the specialty pharmacy to get my meds, get them when I needed them, get them refilled, coordinating with the genetics agency, really coordinating my care, and then communicating with my doctor. So it was immensely stressful. And I think that contributed a lot on top of the losses to why I developed the mental health challenges that I did. I can stop talking now and let others share, but I think you can't know until you're in it how difficult it is. And nobody comes with some special set of skills that get you through it. We're all just, as with any challenge in life, trying to figure out how to navigate this new thing we never thought we would deal with.
Yeah. Thanks for sharing your story, Kathy. It's very just impactful and it's complex, right? These things don't fit neatly into boxes, and it's oftentimes something we never thought we'd face. So thanks for that. Shane, I saw you on mute. We'd love to hear kind of
Yeah.
your perspective.
And I can add a third element. So having gone through fertility and infertility issues, my spouse and I, many years ago, working through Dr. Pritz, did not have the desirable outcomes that many have had a chance to go through with their fertility journey or through Dr. Pritz and her group. But we were okay with that. But I know I can relate, my wife can relate. And what Dr. Pritz brings to the table is the financial side of things, and there's the stress and the just what that aspect brings, especially when you wake up every morning and you question yourself, should I really be considering mortgaging my second house to start a family? And there are people that are out there that, that is absolutely, they're going to go through and do that. From our perspective on the mental health side, everybody deals with stress, anxiety, and mental health, especially if you think about what has come about since COVID. It has really been a hot topic, but even well before that, Trek has really been an enabler to wanting to provide time, tools, and resources to their employees to live a happy and healthy life. And fertility was, we'll get into this a little bit more, but it was kind of an afterthought of how it actually came in place. But to speak to the mental health side, we actually had a pretty amazing on-site clinic. And we learned back in 2014, 2015, 2016, mental health was a thing at that point in time, and we were a self-funded health plan, and we were seeing the rise in mental health claims. And it wasn't, we don't know if it was fertility or not, but again, using that data and saying we should have a psychotherapist that works out of our on-site clinic to be there to support our employees, to give them another alternative to seek guidance from, above and beyond the typical EAP solutions that many organizations typically offer. And that was the start of it. And then doing some simple lunch and learns and webinars about time management, and working through work stress and work-life integration. Everybody talks about balance, and I think it's more about integration than it is really balance. But that was the start of this, and since we've only grown it since that was the entry level. Now we have 3 psychotherapists that work out of our on-site clinic, and we're providing these resources to employees at no cost to them. We are fronting 100% of that cost, because again, there is not just the emotional and the mental toll and the strain, but there's that financial strain. And even though people may have it right in front of them, if they know that they have to experience an out-of-pocket cost, especially if you're talking about fertility, when they know they're bookmarking funds aside for some other procedure that may not be covered, they're probably going to be going down that avenue and not focusing on themselves. But just those are the tools and the resources. But the other thing too is just the time, and having that. Again, what COVID has brought is that hybrid flexibility. We were trying to be in the forefront of that, going much prior to COVID, but giving individuals, giving employees time, and also a safe working environment to actually come to us and talk to us about that. And I'll share a story down the road about just, again, people coming to me, talking to me about what they've gone through, and just not being a leader, or not being an HR person that handles protocols and policies and enforcement, but just being a good listener and saying, I'm sorry to hear you're going through this. I know what you're going through because I've had a similar journey, and let's see what we can do to help you. It was really started to, the HR foundation at that point in time was like, how can we be enablers? How can we be difference makers for our employees? And that's kind of what led to some of our fertility benefits that we're offering, and we'll share here in a few minutes.
Yeah, absolutely. And we've heard that from track employees actually directly, like they feel cared for. And I think that's what every employer wants, right? And so we're excited to hear more in a little bit about kind of how you made that happen. But Dr. Pritz, I know you kind of have a unique perspective, like being in the clinic setting. Do you have any insight or anything to add about how mental health plays a part in people going through this journey?
Yeah, thank you. You probably don't know this, but there's another reason that I know this. I know this personally because I needed IVF. And I was not successful, and ultimately adopted my children. And I was a new professor, assistant professor at the time, and insurance did not cover IVF, and I didn't have enough money because I was in debt from medical school and residency. So I called one of my friends in California, flew out there to do IVF. And when I did, it was less expensive. She gave me a break. But when I did, then I was reprimanded by my employer for taking a week off to fly out to have infertility care. And I was their infertility doc at the time.
Wow.
It's one of the reasons I branched out into my own clinic, but it was the hardest year of my life. I should have been in counseling and did not get into counseling until after the fact. My late husband, right before he left me, I was asking him, and how was I during all this treatment? And there was a 5-second silence, and he looked right at me. And then he looked to the left and he looked to the right, and he said, "Baby, you were great," which means I wasn't great during that time. I'm sure I was lashing out, angry, scared, all of the things. We know that, and I think, Laura, you spoke to this earlier, getting an infertility treatment, a diagnosis, is as stressful as getting a cancer diagnosis. And about a third of our patients actually need some kind of mental health care by the end of this process. We used to have some people in town that would help women specifically and men that had issues surrounding endometriosis, but most of them have retired. And so there aren't really a lot of specialists in the area. Insurance sometimes covers it. More likely that happens now than in the past. We talked about trying to get an infertility or a counselor here on premises, but unfortunately I couldn't afford it. So I was a single clinic, so couldn't afford it at the time. Probably about 25% of my patients ask for anti-anxiety medications or antidepressants. And so I am well versed in those drugs and I prescribe them 25% of the time for my patients.
Wow.
Well, thank you all so much. I can relate on so many levels. You all know, but some don't. I've had my own infertility journey and I opted not to go the scientific way and also adopted my daughters. But it does hit on every emotion possible. It is a grieving process. It's a stressful process in every way, shape, and form, and just a path that I really appreciate you all sharing your insight around. It's important because you don't know until you know. And that's why we want to talk about this today. And regarding additional areas of strain, we can't deny that the significant investment associated weighs heavily on most when contemplating what options to go through and how to navigate their journey. But in particular, we understand most insurances typically only cover pre-infertility related diagnoses, not treatment of infertility issues. Because ironically, treatment is commonly deemed as elective, not medically necessary, which for me, when I heard that through my process, crushed me to my soul that someone out there thought me having infertility issues was a choice. So if you could, would you mind sharing a little bit? I know, Shane, you've done a ton around this, different types of financial assistance, employee benefits, or other means of alleviating this burden outside of traditional medical insurance coverage.
Yeah, and I will say that in 2018, which was the year that at Trek we kind of deemed the year of our family-friendly focus when we were launching our open enrollment, the adding that coverage to the medical plan and providing coverage from a financial standpoint obviously makes a world of difference. And as I alluded to in a few minutes ago, there's so many things you can provide support to as an employer that can make a difference, whether it's fertility or not. And that could be mental health programming. Again, thinking back to the time, additional time off, being, giving flexibility in the scheduling, just allowing individuals to go through what they're going through. And then also that comfort feeling, like when they're coming into the work environment, that feeling of belonging, that feeling of okay, that when they're here, if they need somebody to talk to, that they're going to feel totally comfortable coming to you as far as that's concerned. Obviously the health plan and the immediate financial impacts is a huge piece. But again, like I said, we would tout the mental health benefits, the mental or the teledoc programming. So somebody that can just, have a phone call and talk with somebody, the on-site clinic that we've leveraged. And again, we expanded both our PTO and sick buckets at that point in time. We extended paid paternity leave at that point in time. So again, all of these things, are interrelated as far as that's concerned. But by far above and away, the biggest impact we did was removing one of the biggest obstacles, and that was having some sort of insurance coverage that when an individual was going and they were talking with their OBGYN or their fertility doctor, and they, when you get hit with that first, like, here's the different procedures you can embark upon and here's the associated costs with them. And then it's like that sticker shock. And then all of a sudden knowing that, okay, I think things are going to be okay because we're going to have opportunities to at least leverage this through my employer and their health plan. And here's what they are providing for us. And then being able to give, just give them that opportunity, that choice is just so impactful because everybody approaches this, mentally in a different way. Everybody can facilitate how they put one foot in the other in front of the other everybody does it a little bit differently. Kathy explained it very diligently, and I can relate because my wife and I were exactly the same way. It's like, wow. And some people just have that sense of overwhelming where they struggle. And when you see people coming to work and they're tired and their productivity is low and their engagement is low, and that's not their typical self, that's when HR has to step in. And then we don't want to have those conversations. We'd rather be up front and on the forefront of that and saying, hey, if you have these problems, come talk with us. We are here for you. We are here to be a difference maker. We are here to support you. So those family-friendly practices or those benefits that you offer, that even if it's not deemed family-friendly, you could have so much impact in many different ways, shapes and forms. So again, time, tools, resources, I'll tout it over and over again. Anything you can shape into that is going to make an impact for somebody that's going through that fertility or infertility struggle.
That's incredible what you've done, Shane. And you've touched on a few things, right, in broader perspectives around like paternity leave and time off. I think it's important for people to hear what that really consists of, because that sounds like maybe people think, oh, well, we're doing that. But I think you've taken that to a next level that most organizations, maybe haven't seen or been able to implement yet. Would you mind talking a little bit about
Sure.
some of those specific areas where you're supporting the families in that
Absolutely.
manner?
So the fertility coverage for Trek actually started because we were benchmarking the Forbes Top 100, some of the best places to work in the United States, and we were looking at mainly leave. It was increasing paid sick time in our vacation buckets. It was extending or adding new holidays to our portfolio. And then specifically, like we had a very small scale paternity leave through our maternity leave through our disability program, but it was like 6 weeks. It was 60% of the pay. So it wasn't like, okay, we were checking the box per se, but then the ask for me and my group was like, well, is this a difference maker? Like, are we making an impact here? Are we truly retaining talent because we offer these benefits? Are we going to get rock stars that are entering the talent pool because we're offering this? And when we went out and we were talking with some amazing organizations, what blew my mind was, they were covering the full FMLA, the full 12 weeks at 100%. I mean, Facebook and Google at that time, this is 2017, we're offering, 14, 16, 20 weeks of paid leave. We know we have global subsidiaries. We know in Europe, there's some countries that give you 1 year of paid leave. We know we couldn't go that far, but I said, we have an opportunity to at least, we got to get our feet in the water here. We need to make a splash with this. So we made some different recommendations. We looked at analysis based upon how many kiddos we were having on our health plan. And I will say since then, we've had a lot of kids. It's been great. It's been an awesome journey because collectively our Trek family continues to grow and grow and grow. Moving to that paid maternity leave, and we actually offered 100% of pay at 8 weeks at that point in time, which we have since re-upped again to cover the full FMLA, so the 12 weeks. And I'm not saying that we may not go above and beyond that down the road, but right now, any woman that's working at Trek that goes through the birthing experience is going to be paid in full during her entire FMLA, whether the FMLA is eligible or not. Because we are running into the situation now where individuals are coming and that's their first year at Trek and they're not FMLA eligible. We're still honoring it. We're still paying it. We're still giving the approved leave. So again, that time, those tools, those resources, that was a big thing. And then we've also added a paid paternity leave component as well for fathers at Trek as well since then. So those were the first two things that we really started to focus on. And it wasn't until a conversation that I was having with one of my direct managers back towards the end of 2017 or middle part of 2017. And it was that topic of, I'm tired. I don't want to talk really about the job today. I just want to tell you a little bit about what I've got going on. And I might need to take some time off and need to be there for my wife. And basically the emotional of that 30-minute emotional conversation that we had was 100% around fertility. I'm a middle-aged male. My wife is 2 years older than I am. We have no kids. We've been going through this process for many, many years. We're seeking fertility specialists. We're seeking treatments. We've had miscarriages. We've gone. I mean, it was just like, holy, this is all, coming full circle in my mind as to what I've been embarking upon, 15 years ago. And at that point in time, like I said, something kind of triggered, and it was like, we're missing something here. We can put something of value that could potentially impact people in a very positive way. And imagine that if they had that to at least think about the differences, the different options that the different roads that they could take in their journey. But more importantly, imagine the level of engagement they're going to bring back, because now they've got alternate reasons to kind of embark upon it. They don't have to worry about certain things anymore. They may, but not to the fullest extent. And that's really so when we were doing these benchmark calls with these amazing companies, I remember I'm like, hey, I'm calling them back up again. And I'm like, I got a part 2 to my parental leave question. And that question is, do you offer fertility coverage or infertility coverage? Maybe the better way to put it. Do you offer any stipends or subsidies? Do you build anything into the health plan? Remarkably, 100% are like, it's all part of our health plan. It's all part of our programming. Not only do we cover prenatal coverage in full at 100%, and the breast pumps and everything else that goes along with the birthing journey, but if you're struggling, if you have issues conceiving, we cover, and there was a full gamut of certain things that were covered, certain networks that were covered, to here's your dollar amount that you can go up to. And it was like, Trek, we have an opportunity here. We have an opportunity to really be a difference maker. And I don't know how many people are going to take advantage of this. I don't know how many people are not on our health plan right now that are going to jump onto our health plan because they're going through this and they want to use this. But I do know that we have fertility claims that are being denied, infertility claims that are being denied on our medical plan. We're a self-funded plan. We get that data. And let's just say that if we put an annual stipend and an individual max allowed, for their lifetime with Trek, we could potentially make differences for people with putting very little liability into our health plan programming, again, at a time where we're trying to control the healthcare spend. And when we floated that up to the top, and it's like, if we do this on top of full-blown paid maternity and paternity and other things that we wanted to offer, this could be super impactful. And lo and behold, I still get goosebumps when I think about this, but when we launched it during open enrollment of 2017, and we talked about the paid maternity programming, about the fertility coverage, and we were giving $10,000 per person per year, and we actually included prescription coverage into that as well, because again, just the medical side of things are only a certain cost, and then you've got all the drugs that potentially could come along with that, and all those things add up. So again, we put an annual max, we put a lifetime max, because again, thinking mental health, what may be best for the individuals may not really be the best if they're doing this time and time again, and they're going through that emotional turmoil of, it didn't work. Okay, I got more opportunities to go. There's always that optimism, but again, if you continue to have that, could that be doing more harm than it does good? Not to mention the medical condition that it could take on an individual. So doing those things, and just seeing the response in the different generational responses that we had, and we had 4 generations of workforce working at Trek at that point in time. We have 5 now, but it's like the new employees, the younger employees, to the individuals who are later in their work life are like, if I had this 25 years ago, this would have been absolutely a game changer. I applaud you. Like I said, I still get goosebumps now talking about it. But we knew right then and there that was the right move. And we can thank some of the benchmarks that we've done with some other amazing companies that kind of helped us, just like, hey, this is going to help us on our great place to work journey. This is going to help us protect our culture, but be there to support our number one asset, and that's our employees. And again, those time, that was an easy thing, but this was a tool and definitely a resource that we wanted our employees to take advantage of if they had that need for it. And the success story we had in 2018 and early 2019 is we had 9 individuals that went through the process that actually had success. They actually had a baby, a healthy baby boy and girl. We had a couple twins, which again, we all know that's the risk with these treatments. But we have 7 of those individuals still with us today, and it's really amazing to see the pictures and the family, and these little kiddos are getting so much larger, and seeing what they're on their Trek bikes now, and it's just the sheer joy, the sheer passion. Again, there is a cost component, I get it, but I think the return on that investment, the level of engagement, those individuals are now ambassadors for life for Trek, and that's what we're asking for in just in our workforce. That's the culture we've been striving to build upon. And every year it's like newer, bigger, better, different. How can we continue down that approach? And that's really when we outline, we try to generate that buzz every year for open enrollments. Like, what's Trek doing this year? What are they adding? What are they doing? And it's going to be tough to beat that year. But again, that's probably one of the top 5 moments in my professional career, with or without, in or outside of Trek. Because again, these are the memories that they were always being banked upon in my professional career.
Shane, oh, I'm sorry, go ahead, Elise.
No,
I was just going to say, you've inspired me from the first conversation we had with everything that Trek has identified and implemented and continues to look at to implement to help create these stories and truly make a difference in this world. And you're an inspiration. And I just want to thank you for sharing all of that and keeping us thinking differently about all the ways, right? Through expanding parental leave, expanding, incorporating bereavement leave for miscarriages, and just thinking differently about how what you're doing today could be modified to impact and have such power within the lives that you can touch. And so I just want to thank you so much for sharing that.
But I would add one more thing too. The thing from our journey is there's a lot of things you can do to make a difference and to make a splash. You don't have to go all in with everything right from day one, but if you start somewhere, just that's your building block, that's your foundation. And you keep adding on to that year after year. And it could be as simple as fertility coverage. It could be as simple as family, paid family leave. Next on our stable is we're focusing specifically on adoption. So we're benchmarking some pretty awesome programs about adoption, paid adoption or paid leave for families that do adopt, whether it's hetero or same sex. It doesn't matter. We just want to be able to offer that. And then more importantly, in 2024, we're going to be adding an adoption program, adoption benefit, to kind of mirror what our fertility benefit coverage is. Because again, we know that even if people have tried the fertility route and they have not had success, we know also how strenuous and how expensive the adoption process can also be. Again, getting back to that mental health component, that financial assistance. So that's going to be our year of 2024. That's going to be the next thing forthcoming. So if anybody's on working for Trek that's on the call, you're getting a foresight as to what our 2024 plan is already going to be. And if you're not, go spread rumors.
I love that though. That's exactly what came to mind, is that you guys are always looking to improve and build. And I love that people look forward to open enrollment, right? To hear what's new instead of it being like.
We try to have fun with it because it's pretty boring. We all know it as benefit professionals. It can be a pretty boring topic.
Yeah, exactly. So I love that. That's the case with all of you. So Kathy, we know, like, from talking with you, that you do a lot of advocacy work, and you've also worked for companies that you mentioned that have offered fertility coverage, which is incredible. What's been important, like, from your perspective and from an employee perspective, that employers should consider? How has it affected you with staying with a particular job or organization? Or if you could just share a little bit about that.
Yeah, well, I think I'll start by saying that providing insurance coverage for fertility services was not a choice my company made. It was a choice that was made for us by state law. My organization advocates for policy change, and we've actually helped to expand the state law around fertility coverage. So we're all in, but that's something that Illinois, along with 13 other states, requires of insurance plans in their state. And it's something that a group called the Building Families Alliance is working on right now in Wisconsin. So, I know that when we don't have a state requirement, it can be difficult even for employers who want to do the right thing to find insurance coverage for fertility treatment or plans that cover that. So I just want to make a plug for that group. We're working the fertility coverage is in the state budget for the first time this year in the governor's proposal, and we're advocating for that to remain so that more folks in Wisconsin have access to family building services. So number one, that wasn't a choice for my company, but it was something that they fully were bought into, and we could really improve things in Wisconsin pretty drastically. In terms of choices my company did make, and I want to preface this by saying, Shane, it's incredible to hear what you're talking about Trek is doing. And my organization is a $2 million nonprofit funded largely by government grants, right? So we don't benchmark Forbes companies. We look at it and we're like, cool. Anyway, where are the pencils? We don't have any. So we really had to think creatively about what we could do to support families. And I'm part of the executive leadership team for my office. I can tell you the number one thing that my employer did, the reason I came back from parental leave, which is a whole other discussion that comes with its own set of mental health and employee retention challenges, is my employer was there and ready to listen when I wanted to share this part of my life. The day that I told my boss I was experiencing infertility, I was actually on the ovulation drug, which is notorious for causing mood swings. I had a moment at a meeting and I was like, what am I going to do with this? And I went to my boss and I was like, so that wasn't cool. I kind of messed up, but here's what you need to know. And she was like, I don't have any experience with that. And also I want to help you be the best version of yourself. And that was the foundation for the rest of my experience. There was, several years after that where I was in treatment. She was like the fourth person I told I was doing IVF, because I knew that I needed to have her support behind that. So probably the most important thing that my employer chose to do was provide flexibility and additional time off. We had some policies already in place. We also, as a small organization, our director has a lot of discretion. So she was able to sort of work with me the way she would have worked with anybody else. And then we eventually adopted policies based on my experience. So, like I mentioned, part of IVF and other fertility treatments to a lesser extent is that you have to go into the doctor really often. For me, because of the drugs I was using, even during my transfer cycles, I had to be monitored nearly every day. And so I had flexibility to be able to take those appointments when it worked for me and my clinic schedule, and then flex my work time after that. So I didn't have to take the 6 a.m. appointment. I very distinctly remember being in the clinic one day, they were running way behind, and there were several women who were teachers, and they had to take the 6 a.m. appointment. And when the clinic was running 2 hours behind, one woman canceled her cycle in the waiting room. Because she could not continue to monitor and knew she was going to lose her cycle as a result. So I was really, really fortunate that that day, which was an outlier for my clinic, I texted my boss, said, hey, I'm going to miss that meeting, stuck at the clinic. And I was able to go on. And that was the case for a lot of different appointments. One of the other things you don't necessarily know about IVF unless you've done it is there are several procedures involved. An egg retrieval, you go under anesthesia for a surgical procedure. Transfers, my clinic gives you Valium on transfer day, so I can't drive or work on transfer day. I never knew what day that was going to be until 48 hours before. So that's true for everybody for an egg retrieval. My transfer protocol also made that true. So I would sort of hold 2 days here and say, I probably can't take meetings that day, but then at the last minute, I'd say, oh, actually, it's not going to be until next week now. So actually I can take those meetings, but I have to cancel those meetings. Being able to be honest about that was crucial. I don't know how I would have navigated if I didn't have an employer who was willing to hear me out and support me and then provide that flexibility. The last thing my employer provided that we've now instituted as a formal policy is I had additional PTO. Now our company provides up to 2 weeks of additional PTO that can be taken in 1 hour increments for people in fertility treatment. I sort of worked through that. I had, generous PTO anyway, but we were able to navigate that so that I didn't lose a lot of paid time off because, again, you've got those appointments, you've got procedures. The drugs themselves affect everybody differently. So on some of the drugs, I would get migraines with auras and I literally could not function. Other days I was exhausted. The side effects can be really intense. So I needed extra time off for that. And then if you are fortunate, after all of that, you're pregnant, so then you have to navigate what comes with pregnancy and the additional time off. So if my employer hadn't been flexible in PTO and then eventually adopted this policy, I wouldn't have had paid time off left by the time I was pregnant or by the time I went on parental leave. I used some of my paid time off to extend my parental leave. So those were really important things that we did, that my employer did and that we eventually instituted as policies. I think a big thing that kept me at my organization. I've worked at the same company since the Monday after I finished my master's degree. So I'm clearly not trying to go a lot of places anyway. But a really important thing for me in this process was bereavement leave. We provide 2 weeks paid bereavement leave for the loss of a child, and that policy is inclusive of pregnancy loss up till 20 weeks. Folks who experience pregnancy loss after 20 weeks qualify for our parental leave policy, so they can take months. That was really important. Two of my 3 miscarriages required surgery, multiple surgeries in my case, to resolve. In one case, I walked around for 2 weeks after I learned my child had died, waiting for my procedure to be scheduled. It is impossible to work in those conditions. And so I took 2 weeks with each of my later miscarriages, and I took additional flexibility when I had scheduling. The first one had those scheduling issues. I was able to take a lot of space. So that demonstrated to me I had an employer that cared about who I was as a person. It also allowed me to show up to my job when I wanted to, or when I needed something else to think about, and be my full self, because I knew if I was struggling emotionally, physically, whatever, I could step back. And that meant when I came, I was able to bring my full self. And it's definitely kept me around. Lots of people change jobs after they have babies, and that's not an issue, because that's also demonstrated to me this is a place I want to work as a parent, and a boss that I want to work for.
Yeah, that's awesome. I think, you mentioned too, like the time element and managing the time. I've heard even people who haven't gone through infertility, saving the time and then not even having time for that mental health day or the vacation day. And so just being considerate of that or cognizant of that from both an employee and employer perspective, I think is really important. I don't want to not miss you, Dr. Pritz or Shane. Like, I know that in a lot of conversations Laura and I have, employers are looking for that sticking point for people to stay. Do you hear this being part of that conversation either at Trek, or maybe you hear about from some patients too? I'm not sure, just kind of throwing that question out to see if you guys have any insight.
So, yes, we do have some patients who will quit where they are working and work for other companies that will cover infertility treatment. Here at Wisconsin Fertility Institute, of course, anybody that works for me that needs fertility treatment gets it for free. That's just how it is, because that's what we do. They also get 3 months maternity leave, but that really is a different issue from the infertility. But I have had many patients, 5 to 10% have told me we are going to go to work at another place because they are going to cover infertility, and then they stay. Shane, you?
Yeah, I think if you survey your workforce and everybody's like, oh, we would like more time off, please. I mean, that's just the caveat. And I think it's not just about recognizing the buckets of leave you're providing, but it's just the simple flexibility. And I think it starts with a meaningful conversation and being in a nurturing environment that people feel safe to have that conversation, understanding that it's very sensitive, can be very emotional, can be very private in nature. And so again, just, having that door to HR or a door to a supervisor that says, I feel comfortable coming to you and having that conversation, and this is what I'm embarking upon, and this is what this could mean. We always try to go above and beyond. At Trek, obviously we have to have some sort of boundaries that you have to stay within. But we've provided, like I said, just the paid components, the flexibility with the schedules, the work schedules. We've even added a Trek leave program, which is basically just, an additional 4 weeks of unpaid leave if people do absolutely have a need for whatever it is, if it's continuing a disability claim or rehabbing or therapy to get them back into the working world, or if they haven't qualified for FMLA, but they need some extra time because they're dealing with something. Again, we just try to find simple and small ways to absolutely make a difference for people, because again, the more time, tools, resources you can give them to deal with whatever they're dealing with, typically that return is going to be, you're not going to be able to put a price tag on that. the engagement, the loyalty, the playing for the name on the front of the jersey. I mean, that's what we ask for, and when we can feel really good about what we're giving to our workforce to say that, hey, we're doing what we want to do to keep you here and to keep you healthy and happy and making a difference for us.
Wow. I think I'm hearing, oh, I'm sorry, Dr. Pritz, go ahead.
I was just going to comment for both Kathy and Shane. What I hear, which I just really appreciate, is that what you both say is, as an employer, you say to your employee, I see you. I see you. And Kathy, you said, yeah, they saw me. And that, I think that speaks volumes to who's going to stay, who's going to work with you. And I mean, just in the world, we all like being seen. And so I'm just really touched to hear about that this is going on out there. Thanks.
Yeah, Dr. Pritz, one of the things I appreciated you mentioned is, I think you mentioned this, like infertility is not the only high-tech medical treatment. And infertility is not the only disease that requires a lot of physical and emotional caretaking. And that was something my executive team and I talked a lot about when I was going through it and when we were updating our handbook to adopt a lot of cool policies. Is I was really open with my journey. Other people may not want to be as open, but they should still have benefits. And mine is just like one way people's lives are hard. So many folks have caretaking responsibilities, have chronic illness that needs to be managed. Infertility is a disease like any other. It just has some unique challenges. And so we really thought about that when we were writing our policy. And you're absolutely right. It comes down to infertility is particularly challenging. So perhaps if you're really thinking about how to help folks who are infertile, you're going to help a lot of other people too. But it really does come down to recognizing people bring all kinds of stuff with them every day. And if you can help them navigate that, they're going to, be happier, be healthier, and stay.
Wow, you guys are all amazing. Feel so blessed for the conversation today. I think there's this common thread between truly caring and thinking outside of what you personal experiences have been, or what might people need to feel seen and feel supported. And there's so much that talks about the time and the mental health support, right, and the medical support and some of the implications through this. It is hitting medical plans, when there are those complications and surgeries and other things that have to happen. It's out there. So how do we support them holistically in every way, shape, and form? When we were on our journey and we did foster to adopt, there was nothing that covered me taking placement and having time off to build bonds and get to know my kids. I always kept max amount of PTO banked because I knew I would need and want that time. And so what you're doing is making such a tremendous difference. And sometimes I think for employers, we hear it just feels daunting. And the reality is, I think Elise said this earlier, 1 in 8 suffer with infertility issues. And that's what's documented, because a lot of it's not. Once the word infertility even comes up, it's like it goes off the radar. And it's kind of like mental health. It takes, I believe the statistics show 10 years for people to truly seek mental health. So the numbers in which our population is suffering with mental health isn't even truly reflective of how many people are impacted on a daily basis by that. And I feel the same about the infertility side of things. So what you're doing is huge. And some employers just don't know where to start. Shane, you're doing a million incredible things. Kathy, your organization has done so much. Dr. Pritz, you've seen a lot of things, but for those who are just wanting to figure out how to take that first baby step and start small, I'd love to hear for many of you any thoughts on what are some top couple things, maybe things you've already mentioned, but just as a reminder, or other things, those baby steps that they could start to take towards supporting their employees without diving into the full benefit coverage.
At Trek, I know there's one individual that's on this call that the power of feedback, and we always say feedback is a gift. It could be as simple as just softly surveying your workforce and seeing what is important to them, what is missing, what would they like to see, you got to be very cautious in your approach from an HR perspective, because when HR sends those asks out and you say, oh, this is my perfect opportunity to do this, or put this in there, sometimes people have that letdown when that doesn't come into reality. But we do annual surveys, and some of the best ideas we've had have come directly from, employee feedback. Make it anonymous, make it safe for them. That's a simple way. And we did that. We've done that just a couple soft surveys, 5, 6, 7 years ago. And we had a full gamut of things from like student loan debt forgiveness to pet insurance and, all these and everything in between. Like what would you want in your benefit programming? And as we've grown as an organization, as we've evolved, we've continued to add, more and more and more. That's a great baby step, because then you really get a good pulse point of what your culture is looking, what they're desiring, or maybe if people are leaving and you exit interview them and say, give, deep dive, lay it on me. What is the real foundation as to why you might be leaving? Get that real time feedback and do something with it. That's powerful. And that could really drive how much or how little you need to embark upon in which direction you need to go. And it could be, like I said, it could be something as simple as more flexibility in work-life integration. It could be more paid time off, or more structured time, or maybe it's a sabbatical leave, or whatever. There's so many small things that can make a major impact to everyone without putting a ton of cost or structure in place for people to navigate through. So I think that's if I was doing it myself, if I had my own company and this is what I was embarked upon, this would be one of my first initiatives as a leader, to say, give me a pulse point, give me the baseline, give me the true, identity of where we're at from a culture perspective today, and where are we missing the beat, where are our gaps? Let's identify those, and then let's go from there.
Wonderful, thank you. Dr. Pritz or Kathy, anything else you'd like to share for ideas?
Yeah, I would love to, I talked a lot about how much PTO mattered for me, so I'll make a plug for that. But I think the most important thing for me, I can't stress enough, was having insurance coverage. And I know that it's not easy for an employer to just say, oh, now we're going to provide that. So I want to make another plug for folks to get connected with the Building Families Alliance, because, like I said, it wasn't a choice for my employer to provide this. It was state law. And I think there's a real opportunity in Wisconsin for us to change the state law and require this insurance coverage for all folks who need it, whether they're experiencing infertility or otherwise require fertility services to become pregnant. And that'll make it easier for you as employers, right? That'll either mean that your plan is now just going to start covering this, or make it possible for you to find that coverage if that's what you wanted. So the Building Families Alliance is a great place to start. It's a way to have an impact that costs your company nothing, but can make a huge difference. We're doing budget advocacy right now. You can go to bit.ly, and I'll put it in the chat, /BFA state budget. And it would be so impactful to have folks send letters or emails to their legislators saying, I work for a company that wants to do the right thing, and that's why I support this legislation. So yeah, that is something you can do this second that will cost your company nothing and could have a tremendous impact, not just on your employees, but your community. So
thank you.
I just have a little bit of data to add, and this is probably from about 8 years ago, so this may not be updated, but we were looking at coverage for infertility, and they looked to see how much extra it would cost to give $20,000 of fertility coverage for testing and treatment. And the cost was $12 more per person to give everybody that kind of coverage. So yeah, $12 is an increase in cost, but it's not really that much to give IVF coverage. One of the things that is a little bit helpful, there are several insurance companies in town that will cover up to $2,000 for testing, sometimes additionally for testing and some basic treatment. And so if that's all you can afford, if you're an independent person like me, and that's all you can afford right now, $2,000, it's not going to cost you that much for the few patients that want fertility treatment at the very at the very least, you can give them kind of the basic infertility workup, and then also maybe a couple of months of low-tech treatment.
Great point. Thank you for sharing that. I've also heard organizations kind of thinking outside the box. Most organizations we talk to have some sort of wellness initiative, and they try to put together programs throughout the year to address mental health and, physical activity. Some of those more commonly heard about areas of physical health needs, but I've heard where maybe there could be some things around some of the things that drive infertility, like PCOS. Would you mind talking a little bit about that, Dr. Pritz?
Yeah, so let me just back up a little bit. So when you talk about infertility, not trying to lay blame here, although quite honestly, couples usually do either blame each other or blame themselves, just because of the mental issues that are involved, of the emotional issues that are involved. And so for half the time I was being treated, it was my husband's fault, and the other half, it was my fault. At any rate, 35% of the time it is a male factor issue. Is there enough sperm? Is it swimming correctly? Is it coming from the testicle out the tip of the penis? So that's about 35% of the time. 35%, it is a female issue. Is a woman ovulating each month? Does she have thyroid disorders? Disorders of prolactin, that's a hormone that's secreted from the pituitary gland. Does she have polycystic ovary syndrome? For some women, weight loss can cure this issue, and she will become ovulatory. She'll drop an egg each month. So taking care of your weight, being healthy, that's one way to handle this. I've had other patients who are diagnosed with polycystic ovary syndrome, but they actually are elite athletes. They run too much, and it's a whole different issue, but they may come to me with the diagnosis of polycystic ovarian syndrome. So, again, is a woman ovulating every month? For those women, they can maybe still exercise, but maybe not be in such intense training, and maybe gain a little bit of cellulite or cottage cheese on their thighs, and that may help them to start ovulating normally. And it's really the adipose tissue, the fatty tissue on their bodies, that helps them ovulate. There are people that, and then let me go next. 15% of the time it's unexplained, and we're not sure why this happens. The man checks out, the woman checks out. The tubes are open, the uterus looks normal, a woman is dropping an egg every month, the sperm count looks good, but then there are still options of treatment available to them. Lifestyle factors are actually pretty important. So people that smoke, for women, every time we take a hit of a cigarette, it kills about 100 eggs that we have. We're born with only 1 million, and we don't regenerate those eggs. It's over for us. So women that smoke, they go into menopause 5 years earlier. They lose their fertility potential 5 years earlier as well. So smoking cessation is one thing. Again, the health, not exercising too much, got to watch your body weight as well. That can help ovulation disorders. You may have a thyroid disorder and nobody did a thyroid test for you if you're not ovulating. So go to your doc, get tested for some of these basic things as well. And something recent that is kind of a one-off, but I did want to discuss, I got a lot of men coming to me that are getting testosterone injections, and they get them from doctors, and some of the primary care docs in town think that if you give men with low testosterone injections, it will improve the sperm count, but it actually takes the sperm count to 0. So here's just a shout out. Make sure what you're taking, even if it's given from a primary care doc, maybe it's not great for your fertility. And so pay attention to that. And every single guy that's come in that had a sperm count of 0, as soon as they stopped the testosterone supplements, within 2 months, they were pregnant. I know, but it's interesting. So we need to take care of ourselves.
Well, we need to create access so they can go to the right specialist to avoid incurring cost and struggle in areas where they're being provided care by a great physician, but not the right physician.
Yes.
And approaching all of this in a way that's holistic. Wow, thank you.
I just want to that made me think of something, Laura, and it's my advice to a lot of people. Because I live my life online and tell everyone everything. Lots of people reach out to me when they're like, I think I might be having a miscarriage, or I think I might be experiencing infertility. What should I do? And this, obviously, insurance coverage helps here, but there are a lot of people who are being told to wait to see a fertility specialist that don't have to. I did not have to wait 12 months to see a fertility specialist when my menstrual cycles were 90 days long. And my OB was telling me that, so it seemed right. I wish all the time I had gone sooner, because we would have potentially gotten through that really hard period of our life sooner. So when it comes to your fertility, there are fertility doctors. And if you have the ability to see one, you do not have to wait until someone else tells you you can, unless you need a referral. That's a different issue. But I just really want to put a plug for that. I wish someone had told me I could have gone sooner.
Yeah, and Kathy, I'll see people if they have no months of infertility. If they want to come in and just talk to me about preconceptual counseling, in they come. And that's pretty routine across all of the infertility practices that I know. And I do know better than the OBs about how to help you guys get pregnant, for sure.
Yes.
Having said that, once you are pregnant, I have no clue. So back you go. But you're right. Let's put the patients with the correct specialist. I really like that. Thanks, Laura.
Yeah, definitely. And I think advocate for yourself, right? Ask the questions, advocate for yourself. You know your body's better than anybody. You know what you need. Something's telling you, your intuition. Seek out that right physician. And if it doesn't feel right, keep seeking. Find what fits you. So thank you. Shane, did you have anything you wanted to add on that?
We actually have a pretty robust wellness program initiative. It's world class. It's cutting edge. I think when I first came to Trek back in 2014, I was blown away about of all the different things that Trek was doing from a wellness perspective. And again, like fertility and everything else, we just continue to add more and more to it, just so that everybody can take advantage of it in some way, shape, or form. But I completely piggyback on that. Trek put a lot of emphasis on physical health. And then we're focusing a lot lately, the last couple of years, on mental health. This year we're doing more on financial health. I mean, there's so much different to just one's health and well-being than just, what we would normally think about it. So that's kind of our new holistic approach in supporting our workforce. But 100% agree that we've even seen this with personal friends of ours who have not been in the best of health, and all of a sudden you start making healthier eating decisions, better diet, better exercise, and having fertility issues, and all of a sudden, lo and behold, it's like, where good things are happening as far as that's concerned. So we definitely have seen those success stories, both in our personal livelihoods and also in our programming, in the walls of Trek as well. But absolutely, the better the healthier you can make your workforce. There's so much, again, your return on your investment is going to be uncalculated, just of how much you're going to get back from a healthy workforce, in terms of, not using up, lost time, they paid sick leaves, disability, things of that nature. Again, these are just completely off topic, but they can definitely be relative to this conversation.
Yeah. I mean, it all interplays and interacts with one another. So I think that's a good point, Shane. And a lot of employers, are even looking to build those robust wellness programs. And just remember,
send them our way. We got the blueprint.
See, now you can help everyone through that. But it's true that even those who are looking to launch wellness programs or even improve them, you might be helping people that you don't even know through these things too. And so just keep that in mind, that because I know we have a lot of employers on the call today. Wherever you are starting from, there's small steps that can be taken to make a big impact too. So we're kind of coming up on our time here. We have a few minutes left, so I'm going to give our attendees time to put your questions in the chat, because we are doing a little Q&A here before we end. So while you do that, I just wanted to kind of recap that we've discussed a lot of great information today, and there's so much to unpack when it comes to meeting employees where they're at and with family building, because as we've heard, it's complex and affects people in all areas of their life, which is why we needed 90 minutes of this webinar to get through all this content. And the goal offering these fertility benefits is to support employees with family building. And especially now, the demand and need is increasing because we are starting families later due to a multitude of reasons. And there's also many that are taking non-traditional paths to parenthood, kind of, as we've heard, the different opportunities and routes that people take. So we know that investing and offering these benefits and resources can really change the story for employees. And the bottom line is fertility benefits are being paid under medical plans regardless. So offering these supports alongside with it can really help medical and RX spend in the long term. As you've said many times, Shane, it's really an investment towards the future. And really, most importantly, it's truly impacting the well-being and mental health of employees. So just want to kind of check in, Cassie, are there any questions that are coming through the chat that we could kind of pose to our panelists?
Yes, there are. So I have one here that was actually kind of phrased as a statement. So I'm going to say what they put and then ask a follow-up question. So they said, a reminder for employers to be considerate of gestational carriers with their benefit programming as well. As a two-time gestational carrier who's in HR, it is greatly appreciated when you do. Laura, Elise, would you kind of describe what a gestational carrier is and kind of follow up to this sentiment?
I think Dr. Pritz touched on it earlier. Might be best suited. Do you want to comment, or at least unless you had something? I feel like Dr. Pritz is probably the best.
Yeah. So for people that, for the intended parents, the female partner does not have a uterus. Sometimes an embryo will be created and transferred into the uterus of a gestational carrier. And this is a little different than surrogacy, but this woman will carry the pregnancy, deliver the child, but the genetic material may come from the intended parents, or maybe a donor egg and a donor sperm carried in the gestational carrier, but then the intended parents will raise that child. And so that's what a gestational carrier is.
Mm-hmm.
A surrogate is somebody who may use their own egg and their own uterus. Sperm from the intended parent is utilized to create the pregnancy, and that child is delivered. But due to the legal problems that have arisen surrounding surrogacy, very few lawyers will support it. And I no longer work with surrogates. I work with gestational carriers. And that's just in an attempt to protect the children from paternity and maternity problems.
Mm-hmm.
And I actually, sorry, I would love to add to that in terms of benefits for people who serve as gestational carriers. At EverThrive, my organization, a pregnant person is a pregnant person, no matter how that pregnancy ends. And so gestational carriers have access to all of the same benefits as any other pregnant person, including parental leave. We are an organization that advocates, among other things, for birth equity to address the maternal mortality and morbidity crisis. It's a whole other thing we're not talking about here, but pregnancy carries a whole host of physical and mental health risks as well. And so, gestational carriers only have another layer on top of that. So thank you for sharing that, attendee. But I wanted to say, as an organization, strongly consider that pregnant people are pregnant people, no matter if it ends in loss, termination, adoption. If you're a gestational carrier, it's all the same on your body.
Thank you both.
Yeah, thanks for those answers. We had someone ask if there will be any additional, will you be speaking on this topic again in the future?
Yes, great question. We do plan to speak on this topic again in the future. Actually coming up in the fall, the Wisconsin State SHRM Conference, which is the Society for HR Management, is hosting a conference in the Dells, as they do every year in October. And we plan to speak again on this topic there live. It'll be on Friday, October 13th at 10 in the morning. So the registration is, I think, open up or becoming open up soon to attend, and along with the outline of the speakers. So just keep your eye on that, and we'll hope to see some more folks there at that time as well.
All right, next question, kind of directed more towards Kathy. You mentioned living in both Illinois as well as Wisconsin. Do you know if Wisconsin is going to be required to offer fertility as minimum essential coverage?
Ooh, great question. So in Illinois, fertility benefits are part of your minimum essential coverage requirement. In Wisconsin, they are not currently, but as I mentioned, there's a group advocating to change this. The Building Families Alliance is advocating for plans written in Wisconsin to provide coverage for fertility preservation and treatment and diagnosis for people who require that. So that would be folks experiencing infertility, but it would also be folks who need fertility treatment for other reasons, right? So people who are single mothers by choice, LGBTQ folks, and others. The legislation or the policy that's sort of currently on the table in Wisconsin looks extremely similar to Illinois. Minnesota is currently considering a proposal and looks likely to adopt that into their insurance code in the next year. So it'll become back over there. So the answer to your question is currently in Wisconsin, it is not a requirement. It is not part of minimum essential coverage, but we have the opportunity to change that. The proposal currently lives in Governor Evers' budget proposal. We are deep in the state's interestingly complicated budgeting process. And so this is an opportunity to speak up and advocate for this as a part of the budget that we want to see continue to advance. So I put in the chat, I'll mention again, there is a place where you can really easily reach out to your legislator, bit.ly/BFA state budget. It will be incredibly impactful to our coalition to have folks speak up as business owners, as folks working for companies that are trying to do this. Yeah.
Awesome. Yeah, good reminder for everybody that that link is in there. Please click on it if you are interested in doing any of that. All right, next question is, are there any fertility or family building trends or things you are hearing about that aren't as widely known?
On our side, I don't hear anything. I don't know if Dr. Pritz knows of any new hot topics in the fertility landscape.
So yes, so there's a company that I'm starting to work with. I'm consulting for them, so disclaimer here, but they have they're called InvoCell, and they have a way to equalize the cost of infertility. And so the big ticket item during IVF treatment is the laboratory, and that costs tens of thousands of dollars because the FDA is involved. It's a human laboratory, so it's costly. And with InvoCell, they are starting to utilize, it's like a little bullet. I don't know if I have it here or not. I guess not. But it's a little bullet that the woman places in her vagina with a little diva cup on top of it. And the woman incubates the embryos herself for 6 days. And then we take the embryos out of that little bullet and place them across the cervix into the uterus. And this is going to be easily a third of the cost of IVF now, because the laboratory really isn't involved in the treatment at all. They are opening clinics throughout the country, and I'm looking into being one of the clinics that can offer this, because that means that more people can get care. You know, only what they say is that 1 in 8 people suffer from infertility. Only about 1 in 4 of those 1 in 8 can afford to even come and see me. So this is something we're looking forward to. I'm sure there are other companies that are building things like this. InvoCell is just one that I'm looking at, but again, I am full disclosure, I am probably going to be consulting with them very soon, because I think it's cool. And enough of inequality for fertility treatment, enough.
Love the passion. I realized I need to share my screen so that everyone can see those HRCI and SHRM credits. There we go. And we are kind of coming up on time. I just want to thank everyone here for just what a wonderful, comprehensive, and just amazing panel this has been so far. Are there any final words anyone would like to say? I don't want to cut anyone off.
I don't. Go
I would
ahead.
just like to say, at the end of the day, I think we can all agree that family and fertility benefits are truly not just a perk. They're the right thing to do, and we can have real impact on people's overall well-being. And it does have bottom line implications to your organization, but positive if you look out far enough and you're future thinking about how to take care of your employees. So we all feel incredibly fortunate to have had your insight, expertise, and the ability to hear your own stories. I just want to thank you so much for joining us today, our panelists, and for everybody listening in. We hope you found this as full of passionate insight as I did, and we'll be sure to join us on another event.
That's right. And for everyone who is online right now, please remember to fill out the survey. We really would like to hear what you thought of this webinar. There's just a very quick couple of questions that we're hoping that you can fill out for us. Future webinars are coming up. We do have one next month on employee benefit trends, and following that, we'll have some more about the hard market on the commercial side. So if you'd like to join us for any of that, you're welcome to follow us on LinkedIn. We like to share exciting and interesting things happening in our industry. But otherwise, hopefully you have a wonderful rest of your afternoon, and thank you so much for joining us.